The Drug Enforcement Administration's warning of a surge in overdose deaths from fake prescription drugs. The warning comes as the CDC estimates more than 93,000 Americans died, a record high, from drug doses in 2020 alone. The agency says the counterfeit pills are being laced with fentanyl and methamphetamine. It's the DEA's first public safety alert in 6 years. The last was in 2015, when officials warned of a rise in fentanyl-laced heroin. For more, I want to bring in Dr. Ayana Jordan. She's an assistant professor of psychiatry at Yale University School of Medicine. Doctor, thank you so much for spending some time with us on what is a really important and probably too often discussed subject, but one that really affects people in incredible ways. How broadly has the pandemic impacted access to addiction treatment?
Yeah, thank you so much for having me on and covering this such important topic. The pandemic has made it much more difficult for people to access substance use treatment. I try not to use abuse because that's a derogatory term. So really wanting to make sure people understand we're talking about substance use disorder, substance use treatment. It's made it harder because there is difficulty accessing physicians. A lot of people have scaled down in terms of their in-person office hours. And so many people are relying on telehealth in order to see their physicians. And if you don't have access to Wi-Fi or the technology to be able to access treatment, is much, much harder. There have been some gains within the pandemic to make it easier for people who are already in treatment to get access to their medication. For example, there is a medication that's called methadone that treats people with opioid use disorder, and it is much easier in terms of them to get their medication. They used to have to come in every single day, up to 6 days a week to get their medication. And during the pandemic, there were regulations to allow them to get their medication for 14 days or 28 days instead of coming every day. But again, that's for people who are already engaged in treatment. And so it's much more difficult because there's just a lot less availability of physician time. Also, there's been a decrease specifically in addiction psychiatry specialists going into the field. So it's really hard overall, and we're going to see the consequences of people not being able to get into addiction treatment. We're already seeing them now and have been, quite frankly, for the last 10 years.
Yeah. So back to that new warning from the DEA. What kind of counterfeit pills are being found, and what makes them so dangerous and deadly?
Yeah. So what's happening, and again, I just wanted to reiterate that this is not something that is new. I mean, I'm glad that the DEA is talking about it. But again, we've been seeing this uptick in drug overdose death from fentanyl for the last 5 to 6 years. And so what the DEA is bringing attention to is pills that are laced with fentanyl. They are really, seen as actual opioid pills, something that you would see like a Percocet or medicine that you would get from the actual doctor. But again, it's counterfeit. So this is what people are coming in contact with and is really causing the unintentional overdoses. Now, one of the things I want to say is that pills are not the only way that people are using these substances and are being exposed to fentanyl. We're seeing it in methamphetamine. Exactly. We're seeing it in Xannies, or what's called Xanny bars. We're seeing it in heroin and cocaine. So the real issue is not having access to a safe supply of substances and people not knowing that there is this fentanyl, which is a man-made opioid that is in the supply. So I get that there's a focus on the pills, but I just want us to be more broad-reaching and understanding that people are getting access to fentanyl through methamphetamine, Xanax, heroin, cocaine, other things beyond the pills, which is contributing to this massive increase in drug overdose deaths, for sure.
No, yeah, absolutely, and that's a good reminder. How can users tell whether they've gotten fentanyl or meth instead of something else?
Such a good question. So as an addiction specialist, one of the things that I talk about all the time is the best way that you know that you can, to know if something is in your substance is to test it. And unfortunately, in the United States, we have no way to test the supply that people are using. And so one of the things that a lot of harm reductionists and addiction specialists are calling for is for safe testing sites. And these are implemented in Spain and Switzerland and Belgium and Austria and Portugal, and even in the Netherlands, where people are actually able to test to see if they have fentanyl in their illicit substance, whether it be a pill, whether it be cocaine, whether it be methamphetamines. And that way, if they find the presence of fentanyl, they know not to use it. Unfortunately, this is not widely available in this country, and it is really leading to unnecessary and reversible deaths. So when I am treating patients in the clinic, I actually give them fentanyl strips, and I teach them how they can dilute the product, use the strip, and if two lines come up, you know that it's positive and you don't want to use it. But again, those are for people who are already in treatment, and lots of people who use substances are not in treatment. We know it's harder to get access to treatment in the pandemic. So we want to increase access to drug checking sites. But the only way to know, because you can't tell by looking at it, you can't tell, is to actually test the substance itself.
And for those who are battling drug addiction, especially right now in the pandemic where there may be concern about access to people like you who can help with this, what resources would you recommend, and where should they turn if they're seeking treatment?
Yeah, thank you so much. One of the best resources is SAMHSA, which really is the mental health and addiction site for the country. And so to access that, you want to go to, that's the SAMHSA National Helpline. It's 1-800-662-HELP or 1-800-666-4357. For people who do have access to the internet, another easy way is to go to samhsa.gov, SAMHSA.gov, and then you can key in where you can get access to addiction treatment by your state and also in your county. So that's a really nice way to try and get help for sure.
Well, Dr. Ayana Jordan, we appreciate you taking some time on an issue that continues to affect so many across the country amid all the other problems we have. Thanks for your time.
Yeah, thanks for having me. Have a good night.
You too.